Welcome everybody. I'd like to welcome you today to our webinar. My name is Ingrid MacDonald and I'm a director with the peer-to-peer support team in Geneva. We were previously named the state and we have renamed to peer-to-peer support. Today's webinar is focusing on GBV, how can field leadership make a difference? It's part 2 of a 2-part series. We had our previous webinar 2 weeks ago. And before introducing the distinguished speakers today, we have a really fantastic lineup. I wanted to first really acknowledge the unexpected passing of one of our speakers from last week. We were all shocked to learn of the sudden passing of the Executive Director of UNFPA, Dr. Babatunde Oshoteme, last week. I would, along with the team here, like to really express our sincere condolences to his loved ones and colleagues, including all of UNFPA, particularly all of you on the line listening and part of our audience today, and also to all of the others who worked with him through his long and distinguished career. We were privileged to have had him as our keynote speaker on the last webinar to hear his insights, his guidance, his wisdom, his passion on GBV prevention and response, and this is an area that he tirelessly devoted himself to during his career. We really hope that we can continue in this important legacy today, and just really to acknowledge how privileged we were to have had him and how sorry we are about his passing. So in terms of today, I'd also like to go over just a few of the logistics and some of the protocols for using the WebEx platform and this webinar. The webinar will last for 60 minutes. Please ensure that all of you in the audience have your speakers on mute, your microphones on mute, because sometimes it can turn them on, and we've had some problems in recent ones, and it would be very useful if you could just keep an eye on that. I would encourage you all to send your questions in writing through to a question and answer box. If you have a look on your screen at the moment, you'll see at the top right-hand side, we have questions that you can actually put to the speakers, because the last 30 minutes of the webinar allows for an interactive question and answer session. There's also a chat box, so I encourage you to chat. On our last webinar, we had a very active chat, and it was very informative and useful. So please do utilize that. If your audio is weak or problematic, please click to the YouTube live stream. Venkatesh has put it up in the chat box already, so you can see the link there. This requires a smaller bandwidth. The webinar is recorded, and it will also be available at www.deliveraidbetter.org. Together with a summary of the webinar will be shared with all of you and put up on the website as well. Now, to go back to today's topic, GBV, how can leadership make a difference? I'd also like to really welcome the audience that we have joining today. It's fantastic that we've got around 150 people who have joined from 90 countries across the world. I'd like to really particularly acknowledge our colleague from the Federated States of Micronesia. That is true dedication to the cause. We've never had someone from there before. And we know it's the middle of the night for you, so welcome to this webinar. And we also have a large contingent from Afghanistan, Pakistan, the Philippines, South Sudan, Ukraine, and New York City. 70% of people are actually from the field, which is great. So we're hoping that today's speakers can provide you with some of the insights that they bring from their different areas. Also, just a reminder, part 1, Dr. Oshoteme covered the critical importance of GBV in emergency response and the critical role of leadership. He also dispelled some of the myths. The first one, of course, is assume that GBV is occurring. Don't wait for data. The second is it's life-saving. Sometimes there can be concern that it's not a life-saving activity. We quite well covered that issue about how it is an emergency response and critical in an emergency response. Further, that you don't need to be a technical expert to do the work. This is something that requires all humanitarians, as well as, and particularly, leadership, in the role of leadership. We also had the Deputy Humanitarian Coordinator from Nigeria, Peter Lumberg, and he is hosting actually a P2P support team at the moment in Nigeria. So thank you very much, Peter, and a shout out to all of the people in Nigeria who are with our colleagues there. He put forward some very practical field examples that how they've actually been working with one of the most difficult and largest emergencies that the world is facing today. So taking what we had from part one and now moving into part two, I'd like to introduce our speakers. Today we're lucky and privileged to have Miss Kate Moger. She's the Deputy Regional Director for West Africa for the International Rescue Committee. Kate has been working in Africa for over 10 years. She's been the Country Director for IRC in Mali. She's also been Country Director for SAVE in South Sudan, the DRC, Cote d'Ivoire, and she's also had a variety of roles in the area of gender. So she brings a wealth of expertise to us today from that very important operational and strategic perspective that NGOs have. Also, Mr. Neil Bunia, he is the Resident and Humanitarian Coordinator in Pakistan. Neil has got an enormous amount of experience. He's been working in humanitarian and development for over 30 years. He was the Resident Humanitarian Coordinator in Sri Lanka, as well as being the Resident Coordinator in Bulgaria and Belarus. And before taking up the position in Pakistan, he was most recently the Director of UNDP's Bureau for Crisis Prevention and Recovery in Geneva and the Director of UNDP's office here. So I welcome our speakers today. I think that they've got some excellent examples that we'd like to really learn from and capture those practical experiences. So I'd also like to, just before we go into that first question, turn your attention to, on the right-hand side of your screen, you'll see that there's an opening poll. The poll has a variety of questions. It takes you about 30 seconds to complete it. What it does is it helps us to actually improve our webinar, so please do fill in those polls so that it helps us for next time. So, Kate, I'm going to come to you first in terms of our first question. What I'd be interested to hear from you is how has the International Rescue Committee institutionalized GBV prevention and response internally from the global to the local and vice versa? What steps have been taken and how has it contributed to collective response? Over to you, Kate.
Great, thank you very much, Ingrid. I hope you can all hear me okay. I wanted to first of all say thank you to P2P and everyone who's joined the webinar today for the opportunity to speak to you, and also apologise for the fact that I picked up a head cold on a plane coming back from a conference in Europe this weekend. So I hope that's not going to cause too many problems with the communication, and I can get through this without coughing and spluttering too much as we go through. It's really a pleasure and a privilege to be here to talk a bit about the International Rescue Committee's work and the contribution that we're making in terms of the global response to GBV prevention and response. For those of you that haven't heard of the IRC, just to briefly introduce us, we're a multi-mandate organisation working in response to some of the world's worst humanitarian crisis. And our mission is to help people whose lives and livelihoods are shattered by conflict and disaster to survive, recover and gain control of their future. So as part of that broad mandate and mission, the IRC has been working and focusing for nearly 20 years now on programming which is very much focused on promoting women's protection and empowerment. And that focus is really grounded in the recognition that violence is deeply rooted in gender inequality and discrimination, and that any solution must therefore tackle the structural, societal and cultural issues that underpin it. So in thinking about the IRC's specific response to women and girls' needs, we provide specialised GBV services and aim to ensure that GBV survivors have access to clinical and post-rape care, which, as you know, continues to be a gap in crisis settings, to individual case management, including counselling and follow-up, to the provision of safe spaces and psychosocial activities, community outreach and awareness, the establishment of referral pathways and cross-sector coordination. We work on risk reduction for women and girls, and we aim to ensure that there are experts on the ground to assess and establish services and advocate for women and girls. In addition to those specific services that we're trying to provide as an organisation, we are committed to building the capacity of the wider sector, and especially of local organisations, to prevent and respond to GBV when an emergency hits. So over the past few years, the IRC has really scaled up our investments in local community-based organisations, and particularly women's organisations, as the frontline actors in conflict and disaster. And just by way of an example, since 2010, the IRC has trained more than 400 first responders to prevent and respond to GBV in 20 different countries. I think it's also interesting to note that the particular focus on women and girls is situated now in an institutional strategic commitment to gender equality. The IRC has a strategy, IRC 2020, which defines a gender equality commitment that we will ensure all of our programs narrow the gap in outcomes between women and men, girls and boys. And a recognition that in order to do that, in order to be better in our programming, we also need to ensure that our organisation enables women at all levels to fulfil their potential. So a new emphasis on gender equality, both in programming and internal operational policies and practice. And as part of that strategy, we've defined a number of outcomes that we aim to achieve. So those are the positive, measurable changes that we hope to see in the lives of the people we serve, and have built an outcomes and evidence framework around those outcomes. Achieving the outcomes equally for women and girls, men and boys, is critical to the achievement of the overall strategy. And each of those outcomes examines necessary conditions for reducing the gender gap. So in my region, all of our countries have prioritised gender, and 6 out of 8 of the countries have also prioritised GBV outcomes in their strategies, illustrating how the high-level prioritisation influences and informs programme design. Of course, IRC is not alone in these efforts. We've never seen a stronger expression of commitment than there is today from key donors, UN agencies, and all of the practitioners and policymakers on this call to prevent and respond to GBV in emergencies. And so we're part of the global platform of 66 partners on the call to action. We've worked with others to ensure commitments to GBV as part of the World Humanitarian Summit. And we recognise that we need to continue to push for common advocacy at the global, regional and country level to ensure that GBV is being prioritised across the system. I think I've probably taken more time than I should have on that first answer, so I'll stop there.
Thanks very much, Kate. I think that you provided some really good insight into how different organisations can make GBV a reality from the global to the local and vice versa. So I really appreciate those insights. Now let's move on to our next question in terms of what can NGOs like IRC do to prioritise GBV prevention and response across collective efforts in countries affected by crisis. How can IRC and other NGOs contribute to those collective humanitarian efforts?
Sure. Thank you. Thank you, Ingrid. I mean, as I started to say, there have been very significant collective advocacy efforts which have resulted in the humanitarian community finally taking GBV emergency response seriously through the development of a number of joint efforts to build accountability and develop policy and practice. To speak to a couple of those, they include the call to action on protection from GBV in emergencies, the real-time accountability partnership, and the rollout of the IAS GBV guidelines. We believe that it's by engaging in these joint efforts and platforms that we can help ensure the coordinated action which is necessary to address the funding, the coordination, the implementation, programming gaps that we see in the GBV field, and that we continue this pressure to advocate for the implementation of the high-level commitments. So IRC is a call to action member and is one of the founding partners and global coordinator for the Real-Time Accountability Partnership, which does exactly that, which aims to translate those high-level commitments into concrete guidance for leadership on how to prioritize GBV during each phase of the humanitarian program cycle. So without going through the details of all those examples, the RTAP framework speaks to humanitarian coordinators, to humanitarian country teams, to donors, and makes specific recommendations on what they can do differently to ensure that GBV is prioritized. And we're already starting to see the results of this work. For example, the Cameroon humanitarian country team has recently selected GBV as one of 3 key protection issues in their strategy, which they're currently developing for a context which very definitely requires that. We also believe it's important to make sure that we're using the GBV working groups in the field and the global GBV AOR as advocacy platforms to call for attention to GBV in all emergencies. We need to use those field-based bodies to disseminate global policy and advocacy efforts, including the call to action. And we need to make sure that the existing minimum standards are implemented in order to reduce the risk to GBV across emergency settings, specifically through the rollout of the updated GBV guidelines. We firmly believe that GBV is the responsibility of all the humanitarian clusters, the sectors, the different agencies, and not just those organisations which are focused on protection or have a focus on women and girls. And the recently updated IAS GBV guidelines, which are being rolled out in different field locations at the moment, are critical. It's critical that all of the organisations are working together to ensure that they're implemented in all emergency response. Because as you said in your introduction, Ingrid, reducing women and girls' risks to GBV is life-saving. And those risk reduction activities that need to be taken by all humanitarian actors are part of our jobs and not just those who are GBV responders. So IRC, together with numerous partners, both local, national, and at an international level, believe that working together means that we can ensure a positive impact in the lives of women, girls, and GBV survivors across the multiple crises that require that input in today's world.
Thank you very much for that, Kate. Some really excellent points there about how NGOs can be working better together and also taking up their leadership roles within HCTs and more broadly. So to move more specifically to that incredibly important role of the humanitarian coordinator and the humanitarian country team, I'd like now to go to Neil Bunya in Pakistan. And really to, Neil, if you can discuss with us, if you can provide us with some steps about how you and the Humanitarian Country team have taken in Pakistan to prioritise prevention, response and mitigation, particularly given it's such a sensitive and important area, and that the response that has been going forward in Pakistan has been at different times some of the world's largest responses, humanitarian response.
Yeah, thanks, Ingrid, and thanks for including Pakistan as an example in this. I think Kate had said that it requires leadership to break through structural inequalities. So, I mean, this doesn't happen without leadership by the country team or the HC in herself. And Dr. Bapatunde, I think, also had talked about leadership in the last session. He had talked about the importance of leadership that's inspired by advocacy, visibility, and accountability. So, you know, taking what he had said in that last presentation that he did, I'd like to give some examples here of how we break through some of these barriers to inertia to take real steps to make a difference. So I think one of the key steps that we've taken is that our humanitarian plan for Pakistan has had a GBV section since 2014. But perhaps a more practical example is we've been really linking the clusters and the work between them and sharing information in preventing, mitigating, and the referral of cases. And one very good example of that is an issue of actually abuse of boy children. And that wouldn't have happened if the education and health clusters hadn't been sharing information. And then we have training across all clusters. A very important thing is that we have made the inclusion of female staff on all missions. At least 30% of the mission members should be female, a key point. And that makes a huge difference. I mean, I was just in South Waziristan in January, which is in the tribal areas, and the women we had in our team, and it was actually less than 30%. We didn't have our guideline. But nonetheless, the women who were there found out much more than I did just through dialoguing with the women about some of the real issues that were presented rather than some of the other issues that were being sometimes shared with us in the more formal settings. Another step we've done, because Pakistan hasn't just been affected by issues of conflict and displacement. It's also been very badly affected by natural disasters, and a key part of our work is including GBV and the preparedness measures that we take. So we have collaboration with the National Disaster Management Agency's Gender and Child Cell, and that links up also with work that we do at the provincial level, because Pakistan is very much decentralized. Then we have an interagency and civil society forum on gender, which is part of the Gender Humanitarian Task Force, and that really highlights the concerns. And then in our donor briefs, we always bring out those concerns. And then there's a couple examples I just wanted to give. With respect to some of the work that we practically do, we really try to emphasize issues of sex, age, and disaggregated data. And it's not just about the data being disaggregated, but it's also the way we use it. For example, the sort of questions that we apply in such circumstances, so that there's targeted questions that bring out information. And I think the table you have shows one result of that, which highlights that when we interviewed households, first people who were in areas where they were displaced, and then we interviewed both male and female-headed households. And then we broke it down not just by the people who were displaced, but then what was the situation when they returned. It brought out very clearly that especially for the female-headed households, there was a much greater exposure to threats, and there was a much greater exposure to violence. And then that was able to inform the activities we were able to undertake. And then, of course, we've tried to train a lot of female staff on data collection. And we try to use women who are very much connected to the community, and that builds us confidence and trust, which in turn permits communication of what's often very difficult information, which culturally people wouldn't share. This issue of trust of the community is key. And of course, we have to find a way to work within local norms and traditions and get the traditional confidence of the leaders of the community, usually the elders, while at the same time actually maintaining our principles and keeping in mind that objective that we really want to find what's happening so that we can help the community, help people do something about it. So more, actually women, but also in some cases men, are not exposed to gender-based violence. So I think I've gone over my my allotted time already, Ingrid, and over to you.
Thanks very much, Neil. And I think that you've really highlighted some very practical steps that you've taken in Pakistan, by both across the clusters, but also within your humanitarian plan, and also in terms of the incredibly important role of having women on the front line to actually ensure that there is access in cultures and in societies where that access can be prohibited based on whether a man or a woman's asking a question, and then how that analysis has taken forward. So I think those are some very tangible steps that have been taken by your HCT together with yourself and your actors there. I'd like now to move on to our final question to you, and this is something that came up a little bit as well in terms of our previous webinar, the issue of culture. I mean, culture is something that is incredibly important. It defines all of us have a cultural aspects to us as people. And in the Pakistan, particularly in terms of the response where you are, the cultural dynamics are very real. So what lessons can be helpful for other operations, including addressing cultural challenges, but also more broadly in terms of the lessons that can be drawn out from the Pakistan situation?
Yeah, Ingrid, I mean, Dr. Babatunde talked about myths in his presentation that he gave a few weeks ago. And I think there's some myths here involved that, I mean, culture, context doesn't need to be a barrier to mitigating gender-based violence. In fact, there's this sort of misconception, as we know, that it's specific to certain countries, and it happens inside and outside of humanitarian situations. But of course, in a humanitarian situation, people are particularly vulnerable. So we've tried to work around that by, as I'd said before, really respecting the role of the community, respecting people, but really emphasizing on location-specific data. If you're doing too macro a picture, you're not going to pick up the diversities. I mean, for example, in Fatah, I've traveled in, or the tribal areas, I've traveled in multiple agencies. Each agency is a bit like a universe in itself, with different cultural norms, different problems. So this location-specific data is very important. And then it's very important to mix sort of hard and soft approaches. I mean, for example, people have very specific needs. Women may need hygiene kits, but when you provide the hygiene kits, it's very important to also make sure that you're providing education about awareness of the issues, and not just awareness of the hygiene kits, but awareness of how they could be exposed to gender-based violence and ways in which they can mitigate it. So we use the hard provision to provide soft education. And then we're always trying to look for opportunities because, again, there's lots of barriers to this being applied. There's lots of structural issues. So we try to look for the space where we can try to prioritize it, whether it's the way we design schools to ensure there's toilets for girls, and they make that a priority in our construction, or whether it's trying to build actually also within the communities local committees where men and women can define their own protection and empowerment solutions. And I have on the table one little example on disabilities. And it's interesting because what it shows by the engagement we had, that not unusual in a situation where there's been fighting, that more of the men are disabled than the women. But what we found is that fundamentally, because the women are caregivers to disabled men, this actually increases the vulnerability of the women to violence. So the intervention is you then need to work with disabled people. You need to take some of the stress off, and you maybe need to provide some monitoring mechanisms to make sure, or ways in which the women can share that, so that they're less exposed to that violence. And then we've talked about deploying male and female paramedic teams to deal with people with disabilities and reduce that level of stress and thereby reduce the vulnerability that women have. Another thing that we've tried to do is to support as many coordination networks as possible across both the issues of, you could say complex emergencies, if that's the word, as well as in terms of our natural preparedness work. And I've referred to the example with the National Disaster Management Agency. Very, very important is that we build quantitative and quality assessment capacity for GBV. The qualitative is as important as the quantitative and sometimes gets lost in the mix. I've mentioned before the importance of having female staff on missions, but it's also having female staff in the office so that they're able to pick up on the issues. But I mean, generally that's a good practice anyways, as we know. And then lastly, I think an important issue is that, in many cases, after a natural disaster, you have a period of extreme stress, but then people start to go home. That happens very quickly. After an emergency that's caused by conflict or strife, they go home a bit slower, but still they go home. And you need to link up and inform your humanitarian approach to GBV with the development continuum. And as you may have heard, I was the resident and humanitarian coordinator in Sri Lanka at a very, very difficult time for the people there. And one of the issues was, although we had fairly good GBV, I mean, it could have been better, but we were aware of it and we had systems in place in this camp. We tried to do it, but weren't really able to do it as much, and were under-resourced when people returned. And we actually found that the GBV issues were actually worse when people returned into a development setting than it was when they were in the camps, where there was although the situation was very extreme, there was monitoring. And because it's not surprising, you have people who are traumatized by war, post-traumatic stress syndrome, and the victims are the people who are weaker, and that's often women and children. So over to you, Ingrid.
Thank you very much, Neil. I think you provided some really good and very tangible and concrete advice there, including bringing up your experience from not only Pakistan but also the Sri Lankan context in a way that allowed us to visualize that very clearly. I'd like to, now we're moving into the question and answer stage, so really to also thank you, Neil and Kate. You have been exactly on time, and so that gives us 30 minutes to really get into some questions now. So please, those of you who are part of the audience, please do keep on sending your questions. We've actually got quite a lot that have come in. And also please do use the chat function. There have been some questions that have been put there. So there are quite a few experts on this webinar, and so it's helpful if you have a look at that, because you may actually find that some of you can answer each other's questions, which can be really a useful tool. Just one final thing, just to remind. Now, I want to go straight to you, Kate, here. There's been an important question that came in straight away, and this is the issue about SGBV, sexual gender-based violence. And it's not just an issue about girls and women. It's also an issue about boys and men. And it can be a particularly sensitive and a very difficult issue in many cultures. In fact, all cultures, there's sensitivities around it. And the support and the actions that are required, of course, will need to be different as well. We've seen this a lot with the migration situation that we have at the moment, as well as trafficking and the exposure, particularly of young boys, to some of the risks that they face. How do you address that area? How do we do an assessment that is effective? How do we actually access those people given the sensitivities around it? And then how do you construct a response and an effective response? Have you got any lessons that you can share with us?
Sure, thank you for that, and thanks for the question. It is a question that comes up quite frequently, and I think the question is referring specifically to men and boys as survivors of FGBV, and how to manage the sensitivities around that. It's clearly, as you mentioned, it is clearly an area that requires a lot of sensitivity, a lot of contextual and cultural awareness. Otherwise, it tends to stay even more invisible than the issue of GBV affecting women and girls. So the IRC has been working with UNICEF and also through the interagency case management guidelines to develop tools for health and psychosocial staff working with child survivors of sexual abuse in humanitarian settings. Those include new care guidelines for child survivors and tools to build the capacity of service providers who are working with children who have been affected by sexual abuse and with their families. And in there's a specific section on working with boys who've survived GBV, and there's a website which will point you to that. Similarly, the case management guidelines, which we've been involved in with many partners, has a section on male survivors and on LGBT survivers, who are another group who are perhaps discussed less frequently. So we absolutely recognise the vulnerability of men and boys, and the fact that GBV can affect everyone. I would, however, kind of just go back to the fact that that women and girls do face a much higher risk of violence because they're female. That as a result of the pervasive gender inequality, their limited mobility and reduced access to economic and educational opportunities, and coupled with the fact that generally speaking, women and girls' needs are still under-addressed in humanitarian responses. So whilst I really appreciate the question and appreciate the need for us to have the tools and approaches to deal with that particular target group, we would also recommend keeping a focus on women and girls and making sure that we're equipped to support them in and across GBV response. Back to you, Ingrid.
Thanks very much, and I think you quite well covered that. And just to also note to everybody, if you look at the chat function, you'll see there's a number of resources that have been put up by our colleagues about the where you can go and find some of those tools and resources. So Neil, we've got some questions for you around the issue in terms of the composition of missions, particularly the cluster missions. And why is it, what were the factors that prevented having a 50-50 split in terms of 50% men, 50% women in those mission composition teams? And you've already touched on how the HCT has gone about addressing some of that, but if you can elaborate a little bit more, there's an interest to hear a bit more on how that you've done that.
I mean, basically the fundamental reason is that we don't have 50-50 staff. If we had 50-50 staff, it would be much easier to get that participation on the mission. Or in some cases, one way we tried to get around that was that we had staff who weren't necessarily at such a senior level, because they hadn't been because we had this issue of inequality before. So we took some of the more junior staff who were more newly hired, who were women, and we gave them special training on how to participate in the missions and how to ask the questions that were needed. And that meant that at least we were able to get, we were aiming for 30% at least. But the fundamental issue is a larger one rooted in actually culture in Pakistan. I mean, women here have a 26% participation in the labor force. And although the UN is better than that, we partly reflect the environment which we're in. And then, of course, this is also quite a dangerous area. It's a very male-dominated culture. I mean, the women in Fata, most often in public places, are walking in, not Porta is not the word, but they're covered. Over.
Thank you very much, Neil. So, Kate, it's often said that GBV is a technical area. We've covered that. It also came up in terms of the webinar that the first webinar that we had. This misconception of it being very, very technical is also not often helped by GBV experts themselves or the community around GBV. There is often a lot of technical jargon that's used, even the term GBV or SGBV and some of that terminology, which can be quite alienating for those who aren't there. And particularly sometimes there can be the different terms that are used, whether it's victim or survivor or affected person. They are very, very important, but sometimes people just don't know. So what would be interesting is to hear from you how you move past that in terms of the work that you do, and how that could be more broadly integrated in terms of the collective response, and how that we can show that it's not just technical and it's much more operational side of GBV, how to actually demonstrate that more effectively.
Thanks, Ingrid. I mean, I guess my initial reaction is that there is a technical specialism related to gender-based violence, and it's important that we continue to invest in and value that. But where I think this conversation and the number of initiatives that we've already discussed are pointing to is the fact that we're not going to be able to address gender-based violence collectively as a humanitarian international community without engaging leadership to bring about real change. And I think there's a danger of the marginalization or the sidelining of something which is perceived to be technical and therefore inaccessible and difficult to understand. So I think, I think this webinar series is a fantastic example of having the examples that Neil is sharing from Pakistan and other countries, having the examples from the discussion last week of very senior leaders in the humanitarian sectors acknowledging and recognizing the importance of gender-based violence across response areas is a very significant step forward. We've spoken to the operational guidelines which are in place, the IAF GBV guidelines, and the call to action, which has developed a roadmap which gives an operational framework for humanitarian stakeholders, giving really concrete action and indicators at lots of different levels. I think those tools are very useful to move us away from the jargon of GBV into possibly a different jargon of the humanitarian community, but one where we recognise that we do share a collective responsibility for figuring out leadership and operational actions on this. Just to take it back to my own experience, I'm not by any stretch of the imagination a technical specialist in GBV, but having spent time at the head of a country program in various emergency response settings, as a member of the humanitarian country team in various places, I feel from my own experience that it's important that there are non-technical specialists making a lot of noise about this and amplifying the voice of the people who often are the least heard and the least seen in humanitarian response. And so again, just to reiterate that I think that this conversation and others like it, where we hear from senior leadership, is all part of moving the response away from something very, very technical and specific into something that affects all of us in everything we do.
Thanks very much, Kate. really that provided us with some food for thought, and really thank you for acknowledging the webinars. It's excellent to have that feedback, and how we can look at other ways of amplifying the voice outside. I'd just like to highlight for everyone who's on the call, the webinar at the moment, that we have 15 minutes to go, so please do send in your questions. We have quite a lot, but we can still take more. Neil, should the GBV response be adapted to respect local cultural values and encourage ownership? What are the local traditions or some form of GBV or gender inequalities they actually maintain or perpetuate those gender inequalities? How do we deal with the fact that sometimes cultural values and tradition don't always balance with areas such as human rights, the rights of women, and some of these areas?
Yeah, well, good question. And I think it's important to recognize that there's usually a range of values within a culture, and there aren't too many cultures that advocate beating up women, at least at the official level. And I mean, we have some examples here, I think, where we did awareness in communities, and a young boy who thinks that the only way to get married is to have it arranged. He gets his own experience of his sisters being abused, and then he steps up and is an advocate. So, and then we use that advocacy with other parts of the community to convince them that this is something that is wrong, and is something that is out of line, in fact, with the values. So there's, a line where you respect, of course, the values in the sense of the basic, religious values that people have, the basic role and respect for elders. But usually within those value systems, there's a range of things, and there are very few value systems that would advocate that. So it just comes back to the importance of actually having staff who are working with us, who understand that and can find the opportunity and space that there needs to be to make the point that this is wrong, make the point that it's not actually in line with values, while at the same time, not closing the door, respecting the community to open the door to get access, but then to apply to the better values of the community, you could say, so that this is prevented. Over.
Thank you very much, Neil. And as usual, you give us a very great statement there in terms of the fact that it's not tolerable in any cultures or many cultures that we know of. So, Kate, I'd like to come to you now. You discussed the issue of advocacy. It was one of the points that you highlighted in terms of your presentation, in terms of how NGOs can work together and the contributions they can make, as well as more broadly the UN and other actors. But we often speak to the converted when we do advocacy. It's something that sometimes it can be more comfortable to talk to each other. However, it's often also raised, particularly by women, by survivors in particular, that it's not about talking to them, it's about talking to the men or talking to the perpetrators. So I'd be interested to get from you if you've got a good example and something quite tangible in terms of how advocacy and outreach has been taken forward to influence perpetrators and what can be done in this area.
Thanks, thanks, Ingrid. It's a fascinating question and quite a challenging question for me. It's not an area that the IRC is working on specifically in terms of advocating directly with perpetrators. What it leads me to think about, though, as a question relates a little bit to the question that Neil just answered in terms of how our role in having these different conversations in programming around gender-based violence in contexts and cultures that maybe that may be more or less receptive to that in itself is a form of advocacy and is shifting the ways that people are thinking and acting. And so the specific example that I'm thinking of, and it, as I say, it doesn't directly answer the question, but thinking back to some work that I've done in the DRC. Designing and implementing projects looking at violence prevention and response, working with men and women staff in the first instance, and then local communities to change a discourse and to kind of see a shift in the narrative as around how we can and should talk about gender-based violence. I think I can't draw a straight line of attribution between that project and the conversations around it with local leaders, with military leaders, for example, and I can't make any direct link between that and any changes in behaviour around GBV. But I do think that that in implementing projects, talking differently about subjects, we can hope and expect there to be a change in behaviour over time, and it would be an absolutely fascinating project to try and make some more, do some more measurement and get some more data to see if we could actually claim any attribution around that. So rather a long-winded way of saying that it's not an area that we're working on directly. It's certainly an area that I think it would be interesting to explore further.
Great, thank you very much for that, Kate. And I think that this is an important issue that's come up. That came up in the last webinar as well. And Peter gave us some good examples from Nigeria in terms of some of the initiatives that they had tried there in terms of advocating with some of the armed actors in very difficult situations. I think that there are some institutions which have a specific mandate in this area, and what it highlights for us is we probably need to do a little bit of outreach to them. But also, I am aware that with particularly some Indigenous communities and others, there's been a lot of work done on this area about building the empowerment, particularly of young men and youth, to really find their way. And that this has been incredibly important in terms of the reduction of GBV. So it's not just the accountability side, it's also about the identity side and finding a path and having a livelihood and feeling a sense of worth and a whole lot of other things that come into this, which is really important. But we'll definitely follow up on that. Neil, over to you. One of the questions that has come up, and you also touched on this in your presentation, was the issue of the relief to development nexus. This is something I know that you've done a lot of work on. There's a lot of discussion around the new way of working and some of these areas about how we bridge this relief to development divide, how do we make it more tangible. Now, of course, GBV is one of those areas that goes from the prevention to the preparedness, across to the emergency phase, and of course to the reconstruction. It's something that's there before. It's something that's often exacerbated during, and it's unfortunately often thereafter. So I'd be interested to hear from you if there's anything more that you could add to what you presented in terms of how GBV can fit more into that relief development nexus, and what more could be done in that area.
Thanks, Ingrid. There's an awful lot that can be done, and it's important because if GBV happens in a humanitarian situation, the damage is lasting. I mean, someone can be hungry, and provided the hunger isn't so bad that they have permanent health damage, they can get better. Someone's education can be disrupted, but you can make it up. But if a woman or a child is subjected to violence, the damage of that can last for an awfully long time. So it's very important for long-term development health of a country that actually there's effective GBV responses during a crisis, and that applies to, as I said, a conflict but it also applies to natural disasters. And for example, in Pakistan in 2010, 2011, there were massive floods that displaced tens of millions of people at the time. And it put women, especially, and children into much more vulnerable circumstances than they were before. So on the development side, I mean, we do a lot of work, and the Pakistan government is actually, I think, one of the leaders in the world in terms of emergency preparedness. So you've got to put this into your preparedness plans, that this is a risk. And you know, usually the preparedness disaster risk reduction looks more at the physical element of it, but we should actually do, you know, GBV risk reduction in terms of our preparedness work. But then, of course, in a situation such as we've had in Pakistan, where you had massive displacements in a place like Swat, you also need to have work that goes on in terms of violence against women in the development context. And you know, UN Women has quite a large role as the central advocacy organization in the UN on that. UNFPA has quite an important role, and of course there's lots of NGOs. But at the moment we're actually faced with some issues because we're trying to do a transition right now, as most of the people have returned to the areas that they were displaced from in the last years in these tribal areas of Pakistan, and they're trying to settle down and rebuild their life. So we need to find ways to work with the local government and communities and integrate into the UN and NGO programs, that we continue to monitor this and to find ways in which the same sort of reporting that's been done in an emergency situation, when you usually have more money, continues in a development situation. As I said before, unfortunately in Sri Lanka, there were some things that were quite good in the return there. People got to school on the first day back, but I don't think we did enough in terms of gender-based violence, because I think we underestimated the degree to which people were traumatized by the conflict and the effect that had on people. And that should be put in your preparedness planning, and it should be put in the development planning afterwards, and part of disaster risk reduction. Thank you.
Thank you very much for that, Neil. And I do think this is also something that's come up with a couple of our P2P support missions in the field, because this relief to development, the new way of working, is something that there's a lot of discussion about. And GBV is one of those. It's actually an opportunity to look at how we can use something which is one of the key areas that is now being prioritized within the terms of references for every humanitarian country team. It is one of the 4 mandatory areas in those terms of references, as a way of a tangible, substantive area to focus on, rather than just focusing on different mandates of organizations and things like that. So I think you've highlighted quite well in your answer about how you can practically do that. I would also put forward that the rights-based approach is something that also does that within a framework of looking across the humanitarian as well as the development. So thank you for that. Now, we've almost come to the end. We have one more question for Kate before we do finish. I would like to just point to, if you look on your side, the right side, you will see that there is a closing poll at the moment. That closing poll is very important for us. Again, it only takes you about 60 seconds to do. What it does is it provides us with very valuable feedback that we can use to improve these webinars in the future, and also ideas if you have on topics or other things that you would like to hear from us about. Please be aware that we do focus always on the collective. We do look at leadership, and we also focus very much on what the practical examples from the field in terms of what we look at. Also to highlight that this video, the recording of this webinar, will be available on YouTube, and so you can go to YouTube. We will be putting up details after Kate has finished her final response, and that you can also go to our website, www.deliverabetter.org, and you can see there will be a variety of resources. And after this webinar, we will circulate the webinar summary to everybody, and we will ensure that all of those resources that have been put in the chat will be available or listed in terms of that. So Kate, final question to you. Why is it important to include gender consideration in a GBV response? What about the gender marker?
Thanks, Ingrid. I mean, I would argue that it's important to consider gender in any response, in any humanitarian action, and not just or specifically in relation to GBV. I think we've heard a lot of good reasons for that through the conversation today. That it's helpful to have a gendered analysis of the different contexts in which we're working, the different roles that men and women are playing in a particular context, the impact of any given crisis or humanitarian context on men and women, how they're impacted differently, and also how the impact of our interventions are affecting men and women differently. So I think that that I and the IRC would argue that we need to bring that gendered lens to the work we're doing across all of the sectors in which we're working, and we wouldn't want to conflate GBV response and a gendered response. For IRC, the GBV part is particularly about responding to and preventing the violence against women and girls versus a gender equality approach to ensuring that women and girls, men and boys, all access humanitarian action equally. And we believe that both are essential, both are necessary, and both approaches will support the other to have quality programming and a more specific, a more appropriate response to the whole population.
Thank you so much for that, Kate. So Neil and Kate, thank you for providing us with your insights, your tangible examples, the concrete realities that you bring forward from the context where you're working, and how leadership can take forward prevention, mitigation and response in terms of GBV to support survivors. We've really learned a lot today. It's a continuation of the previous webinar we had. Again, I would point people to our website, www.delivera.org better, and also you'll see there that the YouTube recording will be available. It's there for people to listen to later if they would want to, and it's always very helpful to get your feedback as well, so please feel free to contact us, and we will be circulating that summary soon and updating you with our new webinar coming forward. Once again, thank you, Kate, thank you, Neil, and thank you everyone for joining us today.